Welcome to the Duke Minimally Invasive and Bariatric Surgery Fellowship. I'm Dana Portenier, the Program Director. Jin Yu is our Associate Program Director. We look forward to our virtual interviews and hope this presentation gives you a little bit of an overview of our program. We hope to make our fellowship the best in the world when it comes to both minimally invasive and bariatric surgery. Our teaching philosophy is based on graded autonomy and tailored training. By graded autonomy, this means over a short period of time, fellows learn each case step by step. Within a few cases, they start doing these steps themselves, and within a few months, we expect them to be able to operate independently, doing all of our cases. By the end of the year, our goal is to not only produce fellows who can perform any MIS procedure, but to go beyond and hone the skills to train the next generation of residents in a manner that safely performs the procedures and positively builds the residents' skills and confidence. Our general MIS and bariatric training includes a large volume of bariatric surgery, complex abdominal wall hernia surgery, upper endoscopy, and bread and butter. There are 15 surgeons in our MIS division who contribute to case volume for our 3 fellows. Throughout the year, fellows rotate on 3 core apprentice-type rotations that focus efforts with our bariatric and abdominal wall faculty. The rotations are fashioned to balance clinic and operative experience for fellows across the year. Fellows have a great deal of autonomy in fashioning and on a day-to-day basis, our fellows spend time at one of the 3 different Duke hospitals. This does remain in some flux over the years. Duke Regional Hospital is our bariatric center of excellence and is the hospital where we do the majority of our cases and will be your home base. The main Duke Hospital is where our fellows join faculty for combined cases such as bariatric transplant combination cases or multi-specialty complex surgical cases. Duke Raleigh Hospital is in Raleigh, North Carolina, and it's about 25 minutes away from Duke Regional Hospital and is a significant growth area for our practice, so may assume a larger fellowship training role in the future. Our operating rooms are equipped with state-of-the-art laparoscopic and robotic equipment. One of the upsides of being at Duke is that we often have access to newer technologies before they're out on the mainstream market. Recently, we've been doing many of the FDA trials with some of the newer pre-market surgical robots. We do about 3 to 8 cases per day, depending on the surgeon and the time of the year. As you can see from our handouts that have been provided to you, our fellows on average get between 400 to 600 cases per year. Our fellows are in clinic about 1 to 2 days a week. The clinic is located a couple blocks from Duke Regional Hospital, which makes it convenient for rounding and consult purposes. Fellows do have their own office in the clinic. There are about 10 large exam rooms, making it convenient for our bariatric patients, and there are 2 different conference rooms that we use for group or shared medical appointments. clinic tends to be a pretty good mix of general surgery, including bread and butter cases like gallbladders and primary hernia, but includes significant volumes of foregut and complex abdominal wall cases. In addition, you can see that we have a very high bariatric case volume, so our fellows are well above the required numbers. In addition, we have a robust advanced endoscopy practice, including suturing, dilation, stenting, pH probes, endoscopic sutures, and a host of bariatric complication management. We have a robust research program, and at orientation, the fellows, research coordinator, and faculty go over and run the list of current projects. It's our expectation that all clinical fellows will submit at least one abstract or video during the year, with the hope of a presentation or manuscript at the end. We have a robust conference schedule and learning environment for our fellows. Every Tuesday morning, fellows participate in a resident-focused conference. Every Wednesday morning, there is grand rounds and morbidity and mortality at the main Duke campus that fellows can attend in person or virtually. The first Friday of each month is dedicated to fellow teaching, and both fellows and faculty are cleared of clinical responsibilities outside of emergencies and rounding to dedicate them time to teaching. The morning begins with the ASMBS Fellow Project webinar, where two speakers present a topic from the didactic curriculum required for your fellowship certificate for bariatric surgery. This is followed by our complex hernia conference. We then have a 3-hour time block dedicated to didactic teaching solely to the fellows. At Duke, you will have the opportunity to participate in numerous society and industry-based fellow courses. Our division typically runs several courses, including a mini fellowship course for outside surgeons interested in learning how to do a variety of different bariatric surgical procedures. Fellows will participate in this course. We believe courses are important not just for developing and displaying your skills, but also for networking purposes. Surgeons from around the country come to these courses, and they are a great opportunity to reach out to them for future potential jobs. In our program, there are always one faculty member on call for bariatric surgery across the Duke Health System. Faculty also participate in ER or acute care surgery call. Fellows have an opportunity to moonlight in ER and acute care surgery call. Fellows take bariatric fellow call and cover 24/7 between all three fellows. This can be split up week by week or day by day. It's our preference to leave this up to the fellows to figure out how to fashion the call schedule to their liking. Towards the end of the year, you will be credentialed and privileged in bariatric surgery and will have the opportunity to take attending bariatric call on your own if desired. On our inpatient service, we have two dedicated APPs who are both conveniently named Katie. They help work on the floor as well as consults in the ER. All consults should be staffed with either an APP or fellow, with the attending on call or the attending whom the patient belongs to if they are available. We do have interns that cover the floors at night and on weekends. A PGY3 resident rotates on the service with us for 1 month at a time. They help cover uncovered cases and provide fellows the opportunity to serve as a teacher, taking residents through bariatric and general cases. During the fellowship year, clinical fellows are given 15 days off. These days can be used for job interviews, written or oral boards, and vacation. National conferences that you are presenting at do not count as days off. If you'd like to attend other conference where you're not presenting, then days off will need to be used. Holidays, when you're not on call, do not count as days off. We hope this overview has been informative and helpful and can't wait to meet you soon.